Exploding head syndrome, when sleep sounds like an explosion. Few sleep-related experiences sound as alarming as exploding head syndrome. The name alone suggests violence or neurological catastrophe, yet the reality is far less dangerous and far more mysterious. Exploding head syndrome, EHS, is a rare and poorly understood sleep disorder in which a person hears a sudden, extremely loud noise just as they are falling asleep or waking up. The sound may resemble an explosion, a gunshot, thunder, a cymbal crash, or even a door slamming inside the head. Despite its dramatic nature, the condition is considered harmless. EHS belongs to a group of sleep phenomena known as parasomnias, unusual experiences that occur during transitions between sleep and wakefulness. Unlike nightmares, EHS does not involve fear-inducing dreams. Instead, the disturbance is sensory and sudden, often accompanied by a flash of light or a brief muscle jerk. The episode lasts only a second, but its intensity can leave sufferers shaken and anxious. One of the most unsettling aspects of exploding head syndrome is that it involves no actual external sound. The noise is entirely generated by the brain. People experiencing EHS are often convinced something terrible has happened, a stroke, a brain bleed, or an electrical malfunction. Many report checking their surroundings or even calling emergency services during their first episode. Medical reassurance usually comes later, after repeated events force sufferers to seek explanation. Scientists still do not fully understand what causes EHS. One leading theory suggests a temporary misfiring in the brain's auditory processing system during sleep onset. Normally, as we fall asleep, the brain gradually shuts down sensory input. In EHS, this shutdown may occur out of sequence, causing a sudden burst of neural activity that the brain interprets as sound. Another hypothesis links the condition to sudden shifts in the reticular formation, the brain network responsible for regulating sleep and wakefulness. Although EHS can occur at any age, it appears more common in adults and the elderly. Stress, sleep deprivation, irregular sleep schedules, and anxiety are frequently reported triggers. Some studies also suggest a connection with other sleep disorders, such as insomnia or sleep paralysis, though EHS can occur independently. Importantly, it is not associated with epilepsy, brain tumors, or mental illness, an essential distinction that helps reduce fear once the diagnosis is understood. Despite its frightening name, exploding head syndrome causes no physical pain. The explosion is loud but painless. However, the psychological impact can be significant. People may develop fear of falling asleep, leading to chronic sleep avoidance and fatigue. Ironically, this sleep deprivation can increase the frequency of episodes, creating a vicious cycle. Medical organizations such as the NHS describe EHS as benign and self-limiting in many cases. For some individuals, episodes occur only once or a few times in a lifetime. For others, they may recur over weeks or months before fading away. Treatment is rarely required, but reassurance is often the most effective intervention. Simply knowing that the condition is harmless can dramatically reduce its intensity. In more persistent cases, doctors may recommend improving sleep hygiene, maintaining consistent bedtimes, reducing caffeine and alcohol intake, and limiting screen exposure before sleep. Stress management techniques, such as relaxation exercises or mindfulness, can also help. In rare situations, low-dose medication used for anxiety or sleep regulation has been reported to reduce episodes, though there is no standard drug treatment. Exploding head syndrome also highlights how little we still understand about sleep. The sleeping brain is not inactive, it is highly dynamic, shifting rapidly between different states. Most of the time, these transitions are smooth and invisible. EHS represents a moment when that process becomes perceptible and dramatic. From a cultural perspective, EHS challenges assumptions about mental health and neurological experience. Because symptoms are subjective and invisible, sufferers may hesitate to describe them, fearing disbelief or stigma. Increased awareness has helped normalize the condition, turning fear into curiosity rather than panic. In an era of constant stimulation and disrupted sleep patterns, conditions like exploding head syndrome may become more noticeable, if not more common. They serve as reminders that sleep is a complex biological process, sensitive to stress, routine, and environment. Exploding head syndrome is not a sign that something is breaking inside the brain. It is a sign that the brain, in its transition between worlds, sometimes misfires in spectacular fashion. Loud, shocking, unforgettable, but ultimately harmless, HS reminds us that even in rest, the human mind remains powerful, unpredictable, and profoundly strange.